Good morning. This is going to be session number 1 of today. If you didn't make the cooking class, we are going to be talking about breastfeeding, which is one of the coolest things I think I've learned so far. My name is Chelsea Bigudi, and I am Tsanabithni born for Tsanjikine, Ashian Dashiche Doba Tabahan Dashnale. I am the assistant director at Southwestern Colorado AHEC. I'm the Indigenous lactation counselor, Indigenous breastfeeding counselor. Sorry, and then I'm going to hand it over to Shaw and April to introduce themselves.
Good morning. Shamariso and Shia, non-Asian slow to behind Bashishchi. My name is Shamariso, and I just introduced my clanship. I'm part of the Zuni clan and born into the Edgewater clan. I have breastfed two of my 3 children, and I work for Shining Mountain Health and Wellness as a patient coordinator. And I also am their certified lactation counselor, which I held that for 8 years now. And then I'm also an advanced lactation counselor for the past 7 years. I worked as a LPN for 24 years, and I recently got my registered nurse license. I'm also an Indigenous breastfeeding counselor, just like these two here. And that's been for the past 5 years. I got that in 2020, right before the pandemic. And my goal today is, or in the future, I want to be an Indigenous breastfeeding counselor, or not, Indigenous International Breastfeeding Certified Lactation Counselor. There you go, IBCLC. Thank you.
I'm gonna take advantage of the stage. Just kidding. Yat bene. Good morning, everybody. How is everyone going? Everyone got their coffee? Hello, Zumi. It's me, April. Yeah, She'e, April Salmon, Woye. Harasni Nishne, Sirthani Pashashin, Kis Ani Dashanella, Tulichini Dashache. So what I just said is my 4 clans. I am one who walks around clan from my mom's side and born for Mountain Cove clan from my dad's side. And then I just mentioned my Che, which is my grandpa, who is Bitterwater clan, and my Nully, which is my dad's dad, my other grandpa. He's Laguna Pueblo as well. I am a mom. I have a daughter, Alexis, son, Quinn. Let's see. I'm the public health training associate with SWACAHEC. I was able last year to get my Indigenous breastfeeding counselor certification, and we've been doing a lot of maternal health work. Yeah. What else is there? I think that's it. Thank you, guys.
All right, so this presentation is going to be a lot of basic knowledge and information and skills about breastfeeding that we've learned through our training. And also we have Shaw, who's an advanced lactation counselor. So she definitely comes with some expertise, especially in this region. Okay, so next slide. All right, so we're going to be using our phones during this presentation. If you could go ahead and break those out. I'm hoping the QR code works. If you could tell us a little, in one word, what do you think breastfeeding symbolizes in your community? Is it working okay? Thumbs up? Okay. Okay, and it's not letting me see the responses. So does anyone want to shout out? what breastfeeding symbolizes in your community. Nutritional, empower, prevention, choice, love it. Yeah, so these are some really strong words to start off with. It already shows us that we already kind of have that like leg in the strength in breastfeeding in this community. Okay, in the learning objectives, we are hoping that you are able to take away something new from this presentation. These understanding the importance of breastfeeding in Indigenous communities, describing key practices and techniques to support successful breastfeeding, and evaluate the role of breastfeeding in supporting infant and health development. All right, so we took a little disclaimer from Danae Becks's presentation, but we are all Indigenous, like we were trained in Indigenous lactation counseling under Cami Goldhammer and Kim Salas. So they are definitely women in this field who are leading a lot of the Indigenous breastfeeding movement. So from today, take what is helpful, leave what is not, and a lot of research and perspective and experience is really based on us being Diné women. Okay, and a show of hands, how many of you have breastfed a baby or know someone who have breastfed a baby? I'd say that's half the room. Perfect, more than half the room. Love it. So we are on track then.
So with this slide, we're going to be talking about the cultural significance of breastfeeding. The first point, connecting between motherhood and Mother Earth. So in the Navajo culture, Mother Earth is known as Nahassan, and she is an very important person, Earth, as here. She's all about nurturing vibes that keeps us going, and she is seen as an ultimate life giver, reminding us that how closely connected we are with the land that we live on. So for example, motherhood and breastfeeding showcase that special bond between mother and her child. So just as a mom feeding her baby, Mother Earth gives us everything that we need to thrive into life. So like food, water, shelter, that just connects us, teaching us how we should treat our land with that same love and respect as we do when we show it to our moms. Navajo people have ceremonies too as well to honor moms and soon-to-be moms, celebrating how important it is to nurture families and communities. These practices are recognized, are very sacred and for motherhood and that deep ties to Mother Earth. The next bullet point is breastfeeding has been part of culture practices for generations. So many families have an amazing culture background that deeply roots into our traditions and our spirituality. Navajo people, they are known for their stunning weaving, pottery making, and silversmithing, which that reflects that bond with the land and also that rich history as well. Family and community are super important, often recognized in matrilineal way, where lineage and inheritance come from our moms. So as you notice, like yesterday and today from our native speakers, when we introduce ourselves, we introduce our first clan from our mom's side, and then it trickles down. So our thinking, emphasizing is like more of like living in harmony with the nature and with our ceremonies. So that way we can like keep our language and practices alive. Even though Navajo people honor their past while tackling these modern challenges today. Our next bullet point is about sacred food, first food, which I'll be talking in our next slide. And then milk sharing story. So this is my story from this couple days ago. So I went home and home is like close to Gallup, New Mexico. And so let me say, when I go home, I know I have to wake up before the sun. My parents taught us that way. I used to run, but I'm not, not now. It's just, but so I sat with my parents. My dad built the fire. My mom was cooking food. And then we would just sit at the table. My dad will begin beadworking. My mom will just like read the papers and listen to Navajo Hour. And I was making these crocheting boobs, which we'll be showing you guys soon. So when I was making it, my dad told me in Navajo, Shiaja, what are you making? And I was telling, he thought it was a beanie. He was like, are you making baby beanies? And I told him, no, I'm making boobs. And then he wasn't like shocked or anything. He's just like, oh, Najone, like beautiful. But my brothers on this side, they were just like, why are you making boobs for? But I told him about what we're doing today. So they were just like, oh, that's good. That's good that you're teaching these things. But my dad, he sat there and then he told me about a story from his younger age where so like he grew up with a lot of aunties, and he said that his cousin, but he said my brother, so, but it's his cousin. He said my brother wasn't growing and they were told that he needs more milk. But the reason why was because my auntie was low on milk from her milk supply. So what he said, he's seen like his other aunties and his mom breastfeeding baby. And so that was that milk sharing. And he also told me like, it's different nowadays. Like you hardly see moms breastfeed in public. And a lot of it is because they're probably shame or people don't like it, like seeing that anymore. But he said back then, like it was just normal, we're doing a ceremony or a celebration, mom will just like start breastfeeding and no one said anything. And he said like, but now like it's kind of like sexualized, but hopefully a lot of your teachings will help normalize that. So that's what's my story of the milk sharing. So next is breastfeeding and historical trauma. So breastfeeding in Indigenous culture is often seen as medicine milk, milk medicine, and plays a huge role in health for moms and babies. So it's like I was saying, it keeps culture alive and community strong. Breastfeeding is a long-standing tradition viewed as baby's first sacred food and a way to connect with culture and spiritual aspect of birth and parenthood. But unfortunately, breastfeeding rates in Indigenous populations are usually lower than those in non-Indigenous population, largely because of the impacts of the historical trauma. Some example of historical trauma is colonization, forced assimilation, and discrimination have really affected these practices. So a lot of that was like the forced removal of children, placing them in boarding school, and also that long walk in the Trail of Tears. Many Indigenous moms struggles with barriers like access to culturally sensitive healthcare and resources, making it tough to breastfeed. But the upside, there is a growing movement within Indigenous communities to revive that traditional breastfeeding practices. This not only improves health outcomes for moms and children, but also strengthen that community bond and honor our Indigenous knowledge. So now let's talk about breastfeeding rates among Indigenous moms. So according to CDC's, they say that this just isn't, there's just not a lot of research out there on this topic, which is a big deal because we need to know. The statistics shows that only 73% of Native moms are breastfeeding right away compared to about 38% of all moms across different race and ethnicity. But so you can really see that gap. And if we look at how long these moms are breastfeeding, the numbers aren't great either. So only 42.4% are still breastfeeding at 6 months, and just 20.7% makes it to a full year. It's pretty shocking to think that 76%, or shall we say like 3 out of 4 moms, stop breastfeeding their baby even at 4 months old. And here, another tough statistics is that 97% of moms who didn't start breastfeeding are using formula. That tells us a lot about the challenges that moms are facing today. So why are these rates so low? There's multiple reasons. A lot of it comes down to that historical trauma that I was just recently talking about. And there is not enough information about breastfeeding. And there's also culture and social pressures that are not supportive. And also there's worries about whether they have enough milk. And moms, they're more worried about that. And the challenges that comes with being in low incomes situations. But on top of that, the work and how childcare environment, it could be a real hassle for mom to try to breastfeed. The low breastfeeding rates among Native moms highlight so serious issues that we need to tackle. It's not just about statistics, it's about understanding the real challenges that moms go through with breastfeeding.
So there is this really powerful quote out there by James P. Grant, who is the former executive director of UNICEF. And we also found this quote from our training. He says that exclusive breastfeeding goes a long way toward canceling out the health difference between being born into poverty and being born into affluence. It is almost as if breastfeeding takes the infant out of poverty for those first few months in order to give the child a fair start in life and compensate for the injustice of the world into which it was born. So, as long as baby's receiving milk, breast milk at the very first stages of life, they are at this like fair start in life, because who knows, they might not have the most well put together, I'm sorry, it doesn't matter the parent's socioeconomic status, right, of which they're being born into, because baby is loved, baby is fed, baby is getting the most abundant nutrition. All right, so benefits for baby. Again, breastfeeding, I think we hear this a lot when it comes to breastfeeding promotion, is that it gives baby a healthy start. Colostrum, do we all know what liquid gold is? Have we heard of that term? Yeah. So yes, colostrum is that first milk that mama's body produces during pregnancy. It's usually golden in color and thicker than regular breast milk because it's super rich in nutrients and antibodies that fight off infections. So it doesn't grow a baby, but it protects baby. And there's 3 stages in milk development with mom. It starts with that colostrum, then like after baby's born, it goes into that transitional milk, and then after a couple weeks, that mature milk starts to come in, and that's the milk that baby's gonna be breastfeeding on until they're done breastfeeding. All right, so the reduce of infections, we hear this often in breastfeeding promotion, reduce of colds, flus, ear infections. Breast milk is easily digestible for babies' immature stomachs and intestines. Breast milk can reduce the risk of developing SIDS by almost half. There was a study done about that. And so with mamas who breastfed for 2 months, it reduced the risk by half. It's also the perfect food for premature babies because all it contains is, again, those nutrients, antibodies, and other factors that support their development and immune system. So baby works on supply and demand. And so as long as you're breastfeeding, you're making milk for baby for what baby needs. And so when we think about baby learning a life skill, we were taught in our training that baby is learning this skill to come back to you, because they say that when baby is born, they're this like sacred little being. They're so pure, so full of love, and when they go to sleep, they can transition into that spiritual world, and so when baby comes back to feed, human milk is what facilitates that, right? Brings them back to you to feed again, brings them back to their mamas to feed again. So that is essentially a life skill that baby is learning right there. And also, I think we've glorified um, nighttime feedings too. So when we think about like supply and demand, if baby wants to feed, baby has to feed. So that means going into the nighttime. That means, yeah, when baby wants it. And so a good way to empower mamas is that baby's learning this life skill to come back to you to feed. Benefits for mom. So no surprise that if there's benefits for babies, there's benefits for mom as well. Lowering the risk of certain cancers like ovarian and breast cancer.
Thanks.
Can reduce the risk of postpartum depression, type 2 diabetes. And then it's also super convenient. I don't know if you all have prepped formula before. There's like multiple steps to ensuring like safety, clean, it's hygienic, it's really time consuming. And it's a lot. So mom's saving time and money. Let's see, let's see, bonding time with baby. So it's very important for baby to feel safe, warm, and secure and loved. And this happens in moments of like skin to skin when baby is breastfeeding. So whenever mom is skin to skin while breastfeeding, this can boost her oxytocin levels, which is the hormone we know as like the love and attachment hormone, which is also the hormone that makes her milk flow. Recovery after childbirth. When mom is breastfeeding her baby, she's producing that oxytocin, and this helps contract her uterus, shrink and contract her uterus, and it reduces the amount of bleeding. And C-section healing. This also boosts mom's confidence. When she's feeding, she is what baby needs. And so, and also again, promoting that bonding time with baby. And mom is revitalizing her cultural practices here. April had talked about how Navajos are kind of well known for those silversmithing, rug weaving. Just as we were taught those cultural practices in our art and our crafts, this would have been a cultural practice passed down from generation to generation. All right, so let's see, benefits for the community. So it obviously keeps our valuable natural resources and keeps our environment clean. If you don't know, there's a number out there for 1 year, a baby will use about 120 cans of formula cans, if formula fed. And so formula cans can exist forever. They're not biodegradable. So there's a lot of waste that goes into formula feeding. And then we think about the water usage as well. When families don't have access to running clean water. I know Danae had talked about this a little bit yesterday. That is a problem for some moms, right? Referring back to Navajo Nation, where our communities still struggle with those essential natural resources. So it really comes down to an ethical issue if you're thinking about sending mom home with formula and thinking about those environmental conditions that she could be living with. It also it's a big part of the dairy industry. Formula companies are like the number one consumers of the dairy industry, and we know that the dairy industry is notorious for leaving a big carbon footprint. So it also reduces the risk of chronic illnesses. You know, again, if we're thinking about the child, reducing risk of the child developing diabetes and obesity in the future, it really, this benefits the community down the road. And, you know, Navajo Nation has some of the highest rates of diabetes. So breastfeeding can really help reduce some of those risks. And then it honors our traditions. It honors our connection and relationship with ourselves, our children, our community, and in the land as well.
Yeah, I have this mic. Okay, all right. Thank you, Chelsea and April. So now we are going to transition to the physical aspects of breastfeeding. We'll talk about positioning, proper latching, and we'll go over a few issues related to breastfeeding. So here, when I teach the mom, when they're going to learn how to breastfeed, these are some of the signs that we have to go through for them to realize that the baby is waking up and wants to be fed. So some of those early cues right there is telling them I'm hungry. So the baby is slowly stirring. It's increasing the alertness under closed eyelids. The mouth is beginning to open, and then it's turning its head, seeking and rooting. We're trying to prevent, these cues to going into those late cues there. So this middle cue here is the baby is saying, I'm getting really hungry here. And it starts to stretch. He or she starts to stretch, and he or she starts to increase the physical movement, and it starts to put his hand to his mouth. And this is the late stage here, the late cues. It says, calm me down, then feed me. This is when the baby's just crying and crying. And there's no way, I mean, it kind of stresses out the parent too. So it's time to do some skin to skin right here when the baby's in that late cue. So I'm going to just demonstrate some common breastfeeding positions. Let me see here. Okay, I'll grab this baby. So here's my little baby. Oh. Okay, that's right. I'll sit up here. So the most common one is the cradle hold, and you're just kind of holding the baby like this. Uh-oh, the thing came off. Okay. Sorry. Okay, so this is the classic and it's most comfortable for most moms, especially when the baby is learning to latch. It's also ideal for nursing in public or when you're on the go. Just kind of get your baby up there and then just lets the baby rest in the crook of your arm here like this. And then the baby is supported by your arm like this and they can breastfeed there. And let me see the other one. The laid back nursing there is from, that's also the first breastfeeding. And you can just kind of lay back like this against a comfortable chair and then position the baby there. And I think it's also called a I can't say it. The koala hole. And that's where you can straddle the baby on your thigh there. And then the baby can use the gravity and so the baby can attach better like that. The cross cradle hold is where I'm going to hold like this and then support the head like this. It gives, more control over the baby's head to guide for their latch. And then it's also great for newborns and babies who need extra help with positioning. And then the opposite the opposite hand there, you can support the baby's head and just guide it to your breast there. It provides more room. So the baby you can reposition the baby if needed. The next one is the football hole. So that one, you're just kind of holding the baby like this. Hopefully the baby's underneath you, holding your breast tissue there. And then you just, and this is kind of ideal for C-section recovery, to keep pressure off that incision there. And it's also provides the extra control of baby's head. You can hold here and adjust when needed. You just tuck it under her arm like you're holding a football, and then hold head supported by your hand. And this is useful for people with larger breasts or have flat nipples. It allows the baby to latch more easily. The side lining here. This one's perfect for nighttime feeding. So you can just lay down on your bed, have the baby tuck his arm underneath you and the baby there, and you can just kind of lie down there. Or if you need some resting time, you can also use that too. And it relaxes both you and the baby while makes the feeding more calming. And it helps avoid putting pressure on sore areas or again for C-section and stuff. So that, yeah. Whoop. I'm like attached here, not used to these. Okay. Yeah. Oh, here. So here we, this is what we kind of notice for a proper latch there. We always encourage the mom to notice the nose to nipple there as they're guiding the baby to their breast there. You know, the mouth is wide like that. It's kind of like a gape like that. I want to show with the baby there. Oh, okay. And then you'll see how the cheek is rounded there. That means they're, you know, they're not sucking in like this and their cheek is rounded and they're using those cheek muscles to dry out the milk from their breast there. And then the chin is hitting the breast there and that makes the baby open wider like that. So imagine eating a juicy hamburger or nice looking sandwich and you're just taking that big bite rather than your front teeth and like this, you know, so you're opening that your gate that wide to take in all that goodness of that sandwich there. I did. Oh yeah. So I'll have April demonstrate because her hand fits in there better than mine.
Yeah, I made this puppet last night, so it was born last night.
So, do we go to the next slide or what's the next one? Okay. So here I'm just going to kind of demonstrate a proper latch and stuff. So, you know, having the mom feel comfortable sitting in a chair or a bed.
You guys want to go to the chair?
Oh, sorry.
Hiding behind the code.
Okay, so we want mom to be comfortable and the baby also to be comfortable there too. And then, you know, the mom will hopefully be here with the breast. And, you know, that chin is kind of hitting here. Like I said in the earlier, it's kind of hitting that breast there. And then the nose is to the nipple there. And then that hopefully that will open up the baby's gape like that and take in that breast tissue there. So this one, the whole nipple's in there and hopefully the tongue is curling underneath the breast tissue there or the nipple there and taking in some of this areola part here. And that stimulates the breast tissues to make more milk and stuff. So just be like that. Oop. So that's our proper latch there. Okay, some of the common challenges for breastfeeding, a lot of moms do complain about pain. So pain is kind of broad here. It can be anything like the latch isn't proper, and then or you know the mom is experiencing some other challenges like mastitis or plugged duct here. Hopefully they'll reposition the baby to take away some of that pain. I know there's a little tug when you first put the baby to your breast, but that should go away. And then the other one is low milk supply here. That one we just encourage a lot of parents to do skin to skin and breastfeeding more. It's like 8 to 12 times within a 24-hour. And then latching issues. So hopefully some of those, how we just demonstrate the proper latch there. Yeah, they'll be able to reposition the baby or, you know, reattach the baby to their breast So pain is not common, but it's not normal also. Okay, so how we want healthcare providers to support breastfeeding in our community or any of the Indigenous community. So we wanted them to promote and support breastfeeding and not formula feeding unless the baby needs it. And having them take a breastfeeding class, doing kind of like breastfeeding friendly, some of the hospitals around this area are certified in that. So, getting to know the 10 steps of that breastfeeding policy. And then offering resources here before sending them to a CLC. Maybe they have other resources that they know of, and then just taking a cultural awareness class.
All right, so the future of breastfeeding in Indigenous communities is looking very bright. There are a lot of groups and coalition, task force who are actively in the community trying to revitalize these practices and are doing so. April, Shaw, and I really took advantage of these opportunities because it's definitely one of the coolest topics, like I said. So the Navajo Nation Breastfeeding Coalition Group, they have webinars, trainings, and I think they were actively trying to pass doula certification or doula. It'll come back to me. Changing Women Initiative, New Mexico Breastfeeding Task Force, Hummingbird Indigenous Family Services is actually out in Seattle, but Cami Goldhammer, who we were all trained by, she runs this service. And I know they have a lot of like webinars, especially around Breastfeeding Month. So those are always good to look out for. Some webinar trainings, Milk Medicine Week happens, I believe, the first week in August, and I'm hoping it's going to happen this year again. But that was completely virtual. They had a week-long sessions of Indigenous breastfeeding, and it was full of a lot of awesome topics. And then Indigenous lactation counseling training, that is again, like April, Shaw, and I were all trained under that. And it is focused on Native women to be trained in this lactation counseling. So it is it is more of a peer support counseling. And Shaw and April will do an awesome Native American maternal and perinatal cultural awareness training that can offer it virtually, in person, but definitely look out for those in the future or connect with them if you want that training. And then we have some podcasts that are really awesome and have a lot of information on breastfeeding. And then classes, we give a huge shout out for Shining Mountain Health and Wellness breastfeeding monthly classes. They do a lot of different types of breastfeeding classes for the community. And then resources in the Four Corners area for breastfeeding help. We threw in some phone numbers from the Shining Mountain Health and Wellness breastfeeding group, breastfeeding support group. And then the Four Corners Breastfeeding Task Force, New Mexico Breastfeeding. We didn't find phone numbers for these. And then Colorado Breastfeeding Coalition. So definitely we would love to learn more as well. If there's something up here that's missing, let us know. All right, so break out your phone again. We don't have all the solutions, but we want to identify some of the ways we can support you as healthcare providers and educators in the community. And what are some of the challenges you've encountered in your practice in supporting breastfeeding? Is it the first? Oh, gosh. Okay. All right. Does anybody just want to shout out a couple? No worries. We can totally talk after too. Oh, yeah, we have one.
Hello, my name is Della. It's healthy for the baby to be breastfed because my daughter-in-law breastfed all of her 6 children until they were like 3 years old. So, and I breastfed my kids up to like 6 months, and I have 6 children too. But the last one, I breastfed him for 3 months, and then I just put him on the bottle because I was working. So that's what happened. And my daughter-in-law breastfed her babies up till like 3 years, and they still wanted to be breastfed. She never did put them on formula because I told her formula is more expensive. And it's healthy for the baby. It grows. Like they usually have a chart when you take them to the clinic for their checkups. They'll say where the range is, and you'll see how the baby's grown. It's not malnutrition. It's just like right on the line or a little bit above the line when they do the checkup on the baby. And even their height, when they measure them, even their weight, it's just balance. It balance out in jungle. Okay, thank you.
Yeah,
Hi, good morning. My name is Shusha. So I was just thinking about that, and in our area, we don't really have that many lactation consultants. So I mean, my personal experience was when I had my baby, it was I didn't know what to do. There wasn't really anyone to point me in the right direction as far as who to see, where to go. But I would have to travel to find somebody, and I did find someone in Farmington, just because I was having a hard time with latching. That was my issue. But once I got that latch, it was great. And I breastfed for 4 years. And then after was like, okay, we're done. But I did notice, like, in my reflection in my area, we don't really have that many. We are certified baby friendly. It's just we don't have, I think the lady left already. So we don't really have anybody. So a lot of our native communities would have to go to like Farmington or travel outwards to find those resources.
yeah, in our training, the Indigenous lactation counselor training, with Cami and Kim, when it comes around again, I will share it. But their focus is about really that peer support counseling and not necessarily getting women trained into getting a credential. They know that our communities are our aunties, our sisters, and our grandmas. And so like they're wanting to train as many women as possible because we have that role to support other women. And yeah, and so sometimes it just comes down to getting the training to really support in that way, even though they might not be a CLC. We know from our training too, there was like women in that room that work for Navajo Nation breastfeeding group. I can't remember the name, but she doesn't have like the credentials, but she's been breastfeeding, helping mamas, supporting their breastfeeding journey for years. And but she's a grandma and she's been helping. So I don't know if you know Aura.
Nice.
Nez, yeah. But she's on demand, she's on call and yeah. But yeah, it's definitely a struggle.
I partly comment, partly question. I know historically we had a lot of trouble with dads, male partners, sometimes other family members just really getting on board. And I don't know if that still is prominent and what your thoughts are on that.
Yeah, I do see, I work for the Southern Indian tribe, so, out there, I try to encourage the fathers and other support group that are, encouraging, the mom to breastfeed. And I know it's hard for them to come and even though they say they support their partner. So sometimes I'm really happy when they do bring their partner or their support group. So, but I just stress that every time we send out invitations to the mommies in the community and, just to bring whoever they, is encouraging to continue to breastfeed.
Hi, I'm Heather Sorensen. I'm coworkers with Shaw at Shining Mountain Health and Wellness. And I just wanted to bring up, I think a big challenge is workplace breastfeeding policies. And I think a lot of places have them. But I think that can sometimes, depending on the organization or even the sector of industry, that it's not necessarily accessible to all. And so I think that's, like more like a fast food job or something, it's different if you're in an office where it's easy and you can, or an institution like this, right, where we have a breastfeeding lactation room set aside. But I think thinking about how to make breastfeeding, even though we may have those policies in place, to really make sure that those are accessible across industries and some of those jobs across socioeconomic status or, job sectors like that, especially when you think about anything, industries where you're working outside or you're working, you're running around and it's not as easy to have a room set aside. I think even in large organizations, we may have a policy, but it may not always be fully supported by managers or supervisors. And so I think there's a big gap there that I think there's been a huge progress, but I think there's a lot of work to be done there.
Okay, I think we're down to our 5-minute mark. Thank you guys for sharing that. Those were really great comments. Okay, so key takeaways. Breastfeeding is a cultural health and community practice. It takes, taking that concept, it takes a village to raise a child. It really does. To have them grow up to be healthy individuals. All of us play a part in that. Healthy healthcare providers can play a crucial role in supporting breastfeeding through culturally competent care, or being just culturally aware. There is a momentum in Indigenous communities to reclaim Indigenous breastfeeding traditions. As you saw today, some of the resources we listed, there are groups in the community that are actively trying to reclaim these practices. So thank you. Any other questions? We also passed out a sheet. April found an awesome recipe, which is the lactation recipe. You want to tell?
Yeah, it's not really like a recipe to like cook in the kitchen. It's more, it's more like, if I can borrow someone's paper real quick. Yeah, we were able to find this from a lady named Kristen Stewart, our Milky Way best lactation recipe. So it just like the ingredients, since this is a nutrition conference, we wanted to do like ingredients, 1 lacting mother, 1 infant, and 1 supporting person. And it just gives the step of how you can do better practice of during your nursing. So it was just like a cute little thing for the Zoomies. It was uploaded in the beginning, so it's a PDF on there. But yeah, thank you guys so much for listening to us and a quick Q&A. I know it's Zoomy. I saw it. Go for it.
1 second. Oh, and also if you're interested in becoming an IBCLC, IBCLCs are like the golden standard of where you want to for lactation counselors. So we actually have a student intern who developed a pathway on the options of how you can become an IBCLC. Like, I think nurses, dietitians, they have a good step in it because they have a lot of the coursework out of the way. And so, yeah, if you're interested in that, she'll be in the resource room today and she can share some of that with you. And her name is Alyssa.
On the presentation, there really wasn't anything on, they showed directions of how to nurse, but, diet. I know when I was nursing and low on supply, diet was really helpful. I ate a lot of oats and like chia seeds and things like that, that increased my milk supply, and also not just increased, but I noticed how it made it thicker. Uh, my girls were really hefty. And they were just breastfed until they were like 6 months, and I didn't really start food till later because they didn't really want it. But the nutrition for the actual mother was missing from this. And I wonder, why is that not taught in that program? Because it was so important when I was nursing.
Yeah, I think we wanted to stick to
Mhm.
breastfeeding strictly.
Yeah.
And but yeah, we do know that like cultural foods, one thing we talk about is like the blue corn mush, how that helps with post recovery, and then also helps, comfort mom. It's her comfort food. And yeah, just some of those foods we didn't identify a lot of, but we kind of just wanted to stick this presentation to just breastfeeding, the basics and
So with that
knowledge.
training that's in there though, I was just interested because I
Mhm.
was,
And what training?
your
The,
training that you were talking about, like the more of the peer to peer.
Oh, the
Yeah,
Indigenous
so-
breastfeeding counseling? Yeah, they do teach about nutrition in that course. It's a 40-hour week, so you're there
in-
Monday through Friday. Yeah.
Thanks.
and I think they actually are gonna have it coming up in April. Did we see that they're doing it again in Albuquerque?
Yeah, but I don't remember the dates, but it's Taos, New Mexico.
Mm-hmm.
The one that we went to last year, we traveled to Flagstaff, Arizona to take this course.
We do have a comment online with Salome, who is with the National Jewish Health. Her comment is, many of the women we are working with struggle with breastfeeding because they are trying to quit commercialized tobacco all during postpartum, which is very challenging.
Rexine, could you say that a little bit louder?
Yeah. So this is a comment from Salome with the National Jewish Health. She commented, many of the women we are working with struggle with breastfeeding because they are trying to quit commercialized tobacco all during postpartum, which is very challenging.
Yeah. It's a whole different topic.
There is a lot of information on specific like cases, like even with breastfeeding and tobacco. So Shaw said we will get into a rabbit hole if we get into that one. Okay, to wrap this up, is there any more questions? One more question? Okay.
Hi, I'm Jess Church. I'm a registered dietitian and I work for Common Spirit Health. And first, I just want to say I've been taking lots of notes and trying to think about ways to incorporate more of the work that you all do into the traditional healthcare spaces in hospitals, et cetera, where babies are born. And have great appreciation for the work you do. I'm also going to share a little bit of my personal experience, as a registered dietitian, where we learn from, day one in our training about how breast is best. And my journey for breastfeeding with my little one didn't go so well. And I very much appreciated all of the lactation consultants and folks that helped me along the way. And but ultimately it contributed as well to my own postpartum depression and anxiety, not being able to breastfeed successfully. So I just want to highlight the challenges being so real for moms to successfully breastfeed. It can be easy, and I hope that it is for so many moms with help from folks like you. And so was curious about y'all's perspective on navigating some of those more intimate mental health challenges that moms might have where breastfeeding can be part of it.
For the Southern Indian tribe, we do have behavioral health out there, and some of the moms will go reach out to them and go see a counselor out there. But there, we also stress the postpartum support. No, it's not postpartum, it's PSI. I can't remember what it stands for, but that's another place that people can call and reach out to for mental health services. And then I, as a CLC, I'm not too familiar with all what moms go through postpartumly. So that's still a learning process for me. So I can, learn more to help the moms that are out there experiencing that's mental health challenges. So, but I'm glad we do have our behavioral health out there. You do have to be a patient out there in the clinic, and then they'll refer you over to behavioral health. So we have a building full of them.
I would also add to, like, in our training, we learned a lot about like how significant other support, that means like including them when mama is doing feedings, getting them involved and also empowering them too. Because mom and baby are going to be spending so much time together, and it might, the significant other might not know what to do. So it's like when counselors can get the significant other involved as much as they can, and also empowering them too. And then even like the parents, grandparents, their family, finding ways to empower them as well, to know that this is a very sacred time for mom and baby, and ensuring that they're together, and are supporting even like just around the house. Like, this is what you can do for mom and baby: clean up, wash the dishes, making the space really, really healthy for them to continue what they're going to do. Oh, go ahead, April.
So, if, did it show the same question for, oh, okay. We'll not do that. And if you guys can shout out, I did make some boobs, crochet some boobs, and I'll just throw it out there, so be a good catch. So what's one word takeaway from today's presentation? Gotta be loud. Support.
Fire people.
Here, I'll throw it.
Can help me out.
Okay. Oh.
Peer support, anything else? Okay.
Can you throw it?
Connection, relations, yep.
Is that it?
Oh, Najone. But regain love, and you already got a boob, so. Oh, okay,
Oh.
yeah, sorry. There you go. Tradition, okay,
Want me to do that?
glass boob.
Here.
Oh, just-
Oh, wrong way.
oh, Shaw has all of them.
Yeah, I have
So
one
two more. Encouraging.
Ooh.
And one more word. Empowerment. Cool. Well, thank you
Oh.
guys so much. You guys have a good day. Enjoy all the other presentation.